For the past 35 years, change has been the one constant in the work of our organisation. As the HIV epidemic has changed, our organisation has evolved. We are now responding to a broad range of issues that affect the health and well-being of our community as a whole, with issues such as drug and alcohol use, trans health, family violence, lesbian health, homophobia, transphobia, biphobia, and stigma and discrimination faced by people living with HIV. Our work has also moved beyond Victoria, with health promotion programs and projects that are national in focus. Halfway through the fourth and hopefully the last decade of the HIV epidemic, the time has come for our organisation to reflect the changes faced by our community, while maintaining the legacy of activism that created us in the beginning. In 1983, at the first public meeting to address the developing health crisis of HIV and AIDS, one voice stood out amongst the many. Feminist and activist Alison Thorne motivated and mobilised the community by asking, "What are we doing about this, and how can we do it?" It was Alison's rallying cry that ultimately led to the formation of the AIDS Council. Keith Harbour became president of our organisation in 1987. A man living with HIV, Keith was a pioneering leader who mobilised the community from high-level political policy to grassroots activism with the AIDS Coalition to Unleash Power, ACT UP. Keith continued working to get access to life-saving medicines for people living with HIV until the day he died. In aligning our new brand with leaders like Alison Thorne and Keith Harbour, we're not simply acknowledging the legacy of our past. We're also recognising that the care, health and well-being of the gender and sexually diverse communities will need bravery, commitment, inclusion, imagination and vision. We are now Thorne Harbour Health, and we will continue to work for the dignity and well-being of our communities, now and into the future. Thorne Harbour Health, for the future.